chair. This is what? Seat depth. What is that? Seat depth. If for patient, between his popliteal fossa and the seat, edge of the corner should be around 2 centimeters, 2 to 5 centimeters distance should be there. Otherwise it will compress popliteal fossa, no blood circulation. Okay, so that is the seat depth. Okay, this seat height should be altered according to the patient's height. Okay, and what about this seat width? Width of the seat. You can sit here comfortably? No. For me also little. For him, Adil Abdullah, little this is enough. For me little. For him, little more. Like that. Only one thing which you have to see here is this thigh, lateral part of thigh should not, okay, they should not friction with this surfaces. It should be little free. Why on you are smiling? You want little more big? Go on. Come on. Then, okay. So this is one more thing which we have to prescribe. Now, regarding this, okay, regarding the height of the, what you will call this? Back support. Okay, so this back support, generally if the level of lesion is at the cervical, upper level, they need support up to the neck. Here, up to here or even up to head, they need support. If they can able to move the wheelchair, if a person can able to move the wheelchair, give the seat, now what it is appropriate. Below my inferior angle of scapula. See, it is below my inferior angle of scapula. Can you see that? Yes. That should be. So I can move easily the wheelchair. If it is higher than this, it won't allow me to do this. Okay? Understood? So this is about wheelchair. Now, there is one more thing here called wheelchair skills. What is that? Wheelchair skills. First skill is lifting like this, down. This is what? Wheelchair push-ups. This is for what? For what? Strengthening of upper limbs, strengthening of serratus and latissimus dorsi and all. This will help you in crutch walking, all these muscles. More than that, for changing position. Very good. To relieve pressure source, because there is no sensation. To relieve pressure source, for every 15 minutes like that, they have to do this. Very good. This is one important wheelchair skill. Then another wheelchair skill is holding one arm rest and try to lift the other side of buttock. Okay? This is also for what? Relieving the pressure source. This has to be done for every half an hour. This is one wheelchair skill. Next skill is how far he can able to move the wheel. There is nothing but wheelie. You know how you are lifting car like this? Similarly, if there is anything comes here, he has to lift the wheelchair and he has to move. This we will call it as wheelie. Okay? Lifting it and moving it. Otherwise it will obstruct, restrict. Understood what I am telling? So you have to check all these skills in patients. Push up, bending on one side and lifting the other side for relieving pressure source, and wheelie. Okay? So this is about wheelchair skills and wheelchair prescription. Okay? For tetraplegia, more the width. Okay? Support should be little higher. For a paraplegia, it should be at the inferior angle of scapula. Okay?